I was born in Henderson in East Texas. Grew up there, went to high school there, went to Texas A&M, was a computer engineer major. I graduated in 1991 and then worked for NASA as a robotics engineer for almost 5 full years. My job there was to do a lot of biomedical spin-off work. We were doing robotic vision, but we were applying that to human interactions, and it really made me interested in the medical side of things. So I came home one day and told my wife that I think I'm going to go to med school. And I graduated in 1999. And then I stayed at Baylor College of Medicine in Houston to do orthopedic surgery residency. I finished that in 2004. I then went and spent a year in Boston at Harvard Medical School. I did a combination of 2 fellowships, a shoulder and sports medicine fellowship, and I took a position as a graduate clinical instructor at Harvard Medical School, so I taught med students anatomy. I knew at that time that I was going to come back to Shreveport. I wanted to be in a health system where I could help build a sports medicine program, and I built my practice. We built our home here in Shreveport. I am a orthopedic surgeon, board certified, also board certified in sports medicine. And so my practice over the years, I do a bit of a general orthopedic practice, but has evolved so that about 70% of my practice is shoulder and elbow surgery. The other 30% is knee, ankle, and then of course a lot of non-operative sports medicine injuries that involve the spine, the hip, pretty much head to toe. One of the things that I've done is I've continued to be very involved in our trauma service, and I serve as the medical director for the Caddo Parish Sheriff's Office. I'm a reserve deputy, as well as the Louisiana State Police. And so I do a lot of tactical medicine support for them, and that, believe it or not, the majority of the injuries that the officers get are mostly sports medicine injuries, so it's a natural fit. Another thing people might not know about me is when I was at Harvard Medical School, I trained with the physician that had taken care of the Patriots for 30 years. And I happened to be there at a very successful time in the franchise, and so I traveled with the team. I attended the Super Bowl and was lucky enough that the owner, Mr. Kraft, had rings made for the fellows. There were 3 of us, and so I am the lucky recipient of a Super Bowl ring. I think one of the biggest areas that I've been able to contribute to our region is I've become a referral source for revision shoulder surgery. So people maybe that have had injuries, had surgery elsewhere, that continue to have problems or have new problems. A lot of times people will call and send patients in from all through the Arclitex. Many people know me as a shoulder doc. I also do a lot of elbow reconstruction and knee reconstruction, including ACLs and meniscus injuries, things like that. There are several aspects of my job that I find most enjoyable. Obviously a big one is to see a patient for maybe their last follow-up visit and know that maybe you've spent 6 months or 6 years with them trying to get them over some injury or some condition, and then they leave and they're thanking you for returning their function. That's one of the most rewarding things that pretty much drives us all to go into medicine, but specifically orthopedic surgery. Another thing that brings me really just a lot of happiness is see the development of young medical students and physicians into very, very skilled and competent surgeons and physicians, but who are also very caring. And I think that's important. Burnout is such a big topic in all kinds of fields, especially in medicine. And I think one thing that can help us prevent burnout is to have a genuine compassion for caring for our patients. There was a doctor, Francis Peabody, who in the early 1900s gave grand rounds at Harvard Medical School. And he said the secret in caring for the patient is caring for the patient. And I think that is a motto that I've tried to live by.